Welcome to Adapting Class. This is the Renal Disorder Drugs Part 2 on Pharmacology Practice Test, label number 12. We're dealing with key renal disorder drugs that you need to know for nursing school and then for the NCLEX. 10 questions, I yield medication using NCLEX practice question. You will learn something by sticking around. Let's get to it. First question, what do you see? Which assessments require immediate action? That means we need to intervene right now. It's a selected apply. You don't need to pick everything. This is a new generation NCLEX. Pick those that you are 100% 110 confident. A client with a heart failure is receiving what? IV furosemide. The key fact that you have to know is what? IV furosemide. What's on your buzzword? Furosemide and what? Heart failure require immediate intervention. You have a potassium 3.9, blood pressure 118/72, urine output 2 liters in a day, sodium 135, and a ringing in the ear. Which of this should you intervene? We're dealing with furosemide. It's a loop diuretic. If I give it to you, what do you think it's going to do? It's going to lower your potassium. 3.9 is okay. It's going to lower your blood pressure. 118/72 is okay. Your urine output is going to increase. 2 liters a day is okay. Your sodium is going to decrease. 136 is okay. Therefore, ringing in the ear is one of the side effects, early side effect of furosemide. If you give somebody furosemide too quickly, that's what happens. And therefore, the buzzword is what? Loop diuretic can be orthotoxic. Therefore, if you give in to the patient, slow it down. Don't go too fast. The right answer is what? Ringing in the ear. One answer choice. Therefore, when you see selected apply, be careful. Don't over-select. Next question. Which prescription is indicated that I need to give it to you? The client is prescribed Spironolactone. It's a renal drug. Pharmacology for severe ascites and shortness of breath. Keyword is what? Ascites and shortness of breath. That's the one you're focusing on. Therefore, underline it. Ask yourself, what should I focus on? We have a patient who has what? Ascites, shortness of breath, and I have Spironolactone. Which one prescription is indicated? Do you give them Lisinopril? Do you give them furosemide, triamcinolone, or Spironol? Think about it. What is a Spironolactone? It's a potassium-sparing. If I'm giving you potassium-sparing, I should never give you any more potassium-sparing medication. At the same time, if I use sparing potassium, your potassium goes up. Therefore, what medication would you give to counteract that? That is the key in answering this question. So I want you to think about it. I've given you the clue. Like I said, it's a content learning, renal pharmacology, using NCLEX practice question, critical thinking. And based on that, you can see that these patients need what? Something that can counteract that. Spironolactone causes hypokalemia. Therefore, give them something that will cause hypokalemia, and that will make the potassium normal. Any patient who has ascites always gets spironolactone and what? Furosemide together. And therefore, this is the right answer. Lisinopril is going to increase your potassium. Triamcinolone is going to increase your potassium. Spironol is going to increase your potassium. Those are all potassium sparing, and those are medications you got to pay attention to. Let's receive an order for what? Hydrochlorothiazide, but the pharmacy has run out. Which prescription should the nurse anticipate for a similar effect? That means that medication should have similar effect as what? Hydrochlorothiazide. Underline hydrochlorothiazide and ask yourself, which of these medication does the same thing as hydrochlorothiazide? It has to come from the same class. Spironolactone, acetazolamide, Chlorthalidone, or bumetanide. Look at those medications. You know we've seen spironolactone. Stop the video, put down your answer, and let me know what you think. Spironolactone is a potassium sparing. It's not hydrochlorothiazide. Hydrochlorothiazide get rid of your potassium. Acetazolamide and the bumetanide, look at it. They are from the same group. They are all loop diuretics. Even though they lower your potassium, they don't do the same thing as hydrochlorothiazide. They are not thiazide derivative. Therefore, test taking strategy is something to tell you, you left with Chlorthalidone, hydrochlorothiazide, chlorthalidone, thiazide. Therefore, those are your right answer. Number 3 is the best answer choice. What is the next priority action? You got to be sharp. Breathing issue, electrolyte shock, sepsis, airway. But what is the problem? A client on IV furosemide suddenly report muscle cramps and weakness. Buzzword, muscle cramp and weakness. What is the next priority action? Encourage oral fluid intake, administer oral potassium as prescribed, check serum potassium level, or the next diuretic dose. This is a test-taking strategy. I want you to stop the video. I give you 10, 20 seconds and answer the question and come back. Look at it. You're getting IV furosemide. All of a sudden, you have what? Muscle cramp and weakness. Before you answer your question, you said furosemide causes hypokalemia. Therefore, the reason why patient has muscle cramp and weakness is because they have what? Hypokalemia. Therefore, what do? Do you let them drink water? Give them potassium? Check the serum potassium level or hold the next dose? The best thing to do is what? Think about it. I have muscle cramp and I have weakness. Patient has symptoms. What would you do when you do? You want to confirm it. You don't just give them medication without not doing an assessment and figure out why do they have muscle cramp or weakness. You don't hold the medication without not figuring out what it is. Therefore, this is the key. Hypokalemia is a major side effect of furosemide. Check before you hold it or treat the potassium. You got to figure it out. So we check the potassium, we say potassium is low, and then we can give it to them. At the same time, if patient has symptoms, oral medication is not the best choice to replace potassium. It's always IV. Holding the next dose without not figuring out the source of the muscle cramp and weakness is not the right idea. Therefore, check the potassium level. Which assessment should the nurse prioritize? A client with increased ICP is prescribed Mannitol. Mannitol is a renal medication because it acts on the renal. It's a diuretic, osmotic diuretic. Therefore, which one you prioritize? Number 1, if you have 1 second and you're taking care of this patient, think about it. Nurse, monitor urine output, listen to the client's lung, assess their blood pressure, and check the electroedema. If you are in the nursing school or doing your clinicals, or you're taking the NCLEX, or you're working right now, and you see this question, and then patient prescribe Mannitol, what would you do? Think about, put yourself in that situation. The questions are not there as an isolated information. They're talking to you as a nurse. You have the nurse out, hold on to it. I'm taking care of this patient. ICP, what would I do? You got to go back to the buzzword. Mannitol, what is the major side effect of Mannitol? It's going to pull all the fluid from the brain. Where does the fluid go? It goes into the blood vessel. Where does it go finally? It goes to your lung. Where do you going to have symptoms most? Your lung. If it goes to your kidney, you're going to have high urine output. That's the key. If you go to your kidney, you're going to have high urine output. That's fine. If you go to your blood pressure may go down or go decrease. In the beginning, it goes up, then later on, it decreases because you have urine output goes up. You go to your leg, you have leg edema. But the most serious one is your airway. Therefore, we got to listen to your lungs. I need to listen to your lungs because the major side effect of Mannitol is what? Pulmonary edema. And therefore, that's our primary concern. And so I should worry about it that most. So I listen to your lungs. Which concurrent medication should concern the nurse most? That means you're taking a medication in addition to something that are prescribed to you. And hence is reviewing the medication list of a client prescribed what? Tolterodine for overactive bladder. There's a way to answer pharmacology question, even if you don't know. This is strategy. I want you to listen to that portion carefully and write it down. I see Tolterodine. I have no clue, but look at what is following. There is a way NCLEX give you the question and the answers. Overactive bladder. That means this medication is used for what? Overactive bladder. What does that mean? Your bladder is overactive. That means it's working too much. If the bladder is working too much, You're going to urinate frequently. That's all. It can't hold urine. Any small urine will irritate the bladder and you pass out your urine. Therefore, I got to slow you down. Then the next thing you ask yourself, what is going to slow the bladder down? Cholinergic stimulate the bladder, anticholinergic slow down the bladder. If this medication is slowing down the bladder, then it's an anticholinergic. I should not take any more anticholinergic. I've given you the key. That's the concept. Every question has its concept. Therefore, which one will you avoid? Diphenhydramine, acetaminophen, calcium carbonate, and metformin. Think about it. Put down your answer. Let me know. 6 questions. I know you get 6 out of 6 because you watch Adapting Class. Metformin is not an anticholinergic. Calcium carbonate is not an anticholinergic. Acetaminophen is not an anticholinergic. Therefore, what do you think? Diphenhydramine is your right answer. Tolterodine is an anticholinergic. Therefore, avoid anticholinergic. Diphenhydramine is a strong anticholinergic, and you should avoid it. And that's your right answer. And this is caring for a client with chronic kidney disease who is prescribed what? Calcitriol. Patients prescribe these Calcitriol, which finding indicate the medication is effective, right? Ask yourself, I don't know the medication, but look at the word calci. It sounds like calcium. That's all. Use strategy to answer these questions. NCLEX pharmacology questions, practice tests using test-taking strategy, critical thinking, and expert answers to answer this question. I see Calcitriol. I have no idea, but it looks like calcium. That means this medication has something to do with calcium. I see hemoglobin go up. Okay. I see potassium decrease. Okay. I see blood pressure decrease a little bit. Hey, the thing is going to increase your calcium. Therefore, it said effective. I'm picking number 1. So Calcitriol is an active form of vitamin D. It's going to increase calcium absorption. It prevent calcium loss. It lead to decrease PTH. And this is why we give it to the patient who has chronic kidney disease. The right answer is number 1. The client is prescribed Oxybutynin for overactive bladder. This is the same question we saw in the other medication. I give you the medication. I give you what it's used for. If you don't know Oxybutynin, now you know what it is. It's used for what? Overactive bladder. That means what? It's going to slow the bladder down. It has to be anticholinergic. This is how you break down the question. 50% of your answer choice is by breaking down the question and making it usable. I have a medication I have never seen before, but they told me it's used for what? Overactive bladder. It has to be anticholinergic. Which statement by the client indicate further teaching is needed. They're saying something wrong about anticholinergic. I should drink plenty of fluid and eat fiber to prevent constipation and prevent dry mouth or any other thing. I should avoid driving for a few days. Anticholinergic can make you dizzy and sleepy. You don't know how the medication works, so you should wait. I should expect my mouth to feel dry. Anticholinergic. Test-taking strategy. Number 4 is the right answer. If I don't know what he's saying, I'm going to pick it. That's the key. Anticholinergic effect, increase fluid intake. Therefore, you should not limit your fluid intake. 2 more. And then she's teaching a male client with benign prostatic what? Hyperplasia, BPH, who is prescribed what? Tamsulosin. Used for what? BPH. That means it has to open the bladder. It has to open the prostate and allow the muscle to relax, to allow fluid to flow through. Which client statement require further teaching? I should take this medication at bedtime. It causes orthostatic hypotension. This medication will relax my bladder neck. That's why it's used for BPH. I should rise slowly from a sitting to standing, causes orthostatic hypotension. I should take this medication when I feel difficulty urinating. You should take it every day at night because it's not a PRN medication. It does not work when you take a PRN medication. It needs time to work. Therefore, what do you tell the patient? This medication is taken daily, consistently, no PRN. Number 4, need teaching. Last question. And there's a newness as attending start education side effect of spironolactone. Which of the following should the nurse expect in the client taking spironolactone? Side effect of spironolactone. I will give you the mnemonic for this. Do you watch for hyperkalemia? No substitute to diet? No ACE inhibitor? Risks for muscle weakness or risks for gynecomastia? These are concepts associated with spironolactone. And the buzzword is what? Spare K. The mnemonic for spironolactone is spare K. And what is that? Number one, you got to spare your potassium. So what? Hyperkalemia. You should avoid what? No such substitute. So no such substitute is the P, right? Don't do that. No such substitute to diet, right? No ACE inhibitor, right? You got to avoid ACE inhibitor. There's a risk of what? Muscle weakness. That's the R. And the E, you have gynecomastia, irregular menses because of what? Endocrine. Therefore, spare K is spironolactone. 10 questions, NCLEX practice question, pharmacology practice test, renal pharmacology, dealing with pharmacology drugs associated with both bladder, urinary tract infection. Part 2, take care of yourself. Now you have about 25 questions on renal pharmacology questions.